Have you ever quietly wondered if your size is normal? You're not alone. Many men, at some point, compare themselves to what they think is average. Maybe it started after seeing something online, or a casual joke among friends that stuck in your mind. It's a question that can affect confidence, intimacy, and even self-esteem. And yet most men never ask it out loud. Here's the truth. Your size doesn't define your masculinity, your ability to please, or your health, but it does help to understand what's normal and how doctors actually measure it. Because when you know the real numbers based on medical data, not internet myths, you start to relax. You stop worrying about comparisons, and you begin to focus on what truly matters: function, confidence, and connection. So in this video, I'll walk you through what research says about average length and girth. We'll look at how urologists measure it, the accurate way, and I'll share what factors can naturally influence your size, without gimmicks, without shame. By the end, you'll understand where you stand, literally and scientifically. No judgment, just facts, empathy, and clarity. I'm Dr. Rosalia Viterbo, and this is the truth about what's normal for men, and why that's more reassuring than you might think. Let's be honest, size is one of those topics that can quietly follow men throughout life. It starts early, maybe in teenage years, when comparison feels like a measure of confidence. Then adulthood brings its own expectations, relationships, intimacy, performance. Somewhere in between, curiosity turns into quiet concern. You might catch yourself wondering, am I normal? Or even, is there something wrong with me? That thought can linger. It can affect how you feel about your body, your energy, even your desire. And it's not just about vanity, it's about identity. In my clinic, I hear this question more often than you might imagine. Men of all ages, from their 20s to their 50s, come in seeking clarity. Most of them aren't worried about function, they're worried about comparison. But here's what's interesting. Research consistently shows that men tend to underestimate themselves. They imagine average as something much larger than it truly is. That gap between perception and fact creates unnecessary anxiety. And anxiety has its own effects. It can interfere with intimacy, cause performance stress, and reduce satisfaction, even when nothing is physically wrong. So, why does this happen? Because no one talks about it openly or accurately. Most of the information online is exaggerated, unverified, or meant to sell quick fixes. It's easy to feel uncertain when your reference points are unrealistic. That's why this conversation matters. Understanding what's normal doesn't just ease curiosity, it builds confidence. It gives you a sense of control and reassurance that you are, in fact, healthy and whole. So in the next section, let's replace guesswork with science. I'll show you what large-scale studies have found about average length and girth, and more importantly, how to measure correctly. The medical way, not the myth. Because once you know the facts, you stop comparing and start accepting. Let's take this step by step, calmly, clearly, and scientifically. When men ask, what's the normal size? They're really asking two questions. How do I compare? And does it matter? So let's look at both from a medical point of view. First, what the science actually says about average size. Several large studies have looked at this question over the years. One of the most cited comes from King's College London, which analyzed data from more than 15,000 men worldwide. This wasn't an online survey. These were clinical, doctor-measured results. Here's what they found. The average erect length is 13.12 centimeters, or roughly 5.16 inches. The average girth, or circumference, is about 11.6 centimeters, or 4.6 inches. And here's something important. The range is wide. About 68% of men fall between 11.6 and 14.7 centimeters in length. So if you're anywhere within that range, you're perfectly normal. That means most men who worry about being too small are actually within the healthy average. In other words, what you see online or hear in locker room talk doesn't reflect reality. Those portrayals exaggerate, and they can distort your perception of normal. Now, remember, measurements can vary slightly based on how and when they're taken. Temperature, stress, fatigue, and even time of day can influence results. That's why medical measurements follow a very specific method. Second, how to measure accurately. The urologist's way. If you want to know your true size, you need to measure the same way doctors do. There are two key parts, length and girth. For length, use a firm, non-flexible ruler. Measure from the pubic bone, not from the skin. To find this, gently press the ruler into the base until it touches the bone. This ensures consistency, especially since body fat can slightly mask the base. Measure along the top side, from the pubic bone to the tip of the glans, the head. Record it while fully erect, as this gives the most reliable comparison. For girth, use a soft measuring tape. Wrap it gently around the middle of the shaft. Not too tight, not too loose. You can measure in both flaccid and erect states for reference, but the erect measurement is the standard for studies. And one more note, it's best to take 2 or 3 measurements and average them. That helps avoid small variations that come from angle or position. This is exactly how clinical researchers gather their data. It's precise, it's standardized, and it's free from the exaggerations we often see online. Third, why size varies and what really matters. Now that we know what's average and how to measure, let's talk about why it varies. There are a few natural influences. Genetics. Just like height or shoe size, your DNA plays the main role. Hormones during puberty. Testosterone levels in adolescence can affect growth, but once adulthood is reached, size remains stable. Body composition. A higher body fat percentage can make the base appear shorter. That's an illusion, not a change in size. Temperature and stress. Cold, anxiety, or fatigue can cause temporary contraction of the smooth muscles in the penile tissue. So when you see differences in appearance from day to day, that's normal. It doesn't mean something's wrong. It just means your body is responding to its environment. And here's a key insight. Research shows that function, not size, matters most. Erection quality, blood flow, sensitivity, and emotional connection have far more influence on satisfaction than centimeters ever could. That's something I remind my patients often. Confidence, communication, and care are what partners actually respond to. Fourth, the psychological side. Why perception matters. The mind plays a huge role here. In a 2022 study, men who believed they were below average, even when they weren't, reported lower sexual confidence and self-esteem. But when they were shown the real medical averages, their confidence improved immediately. That tells us something powerful. It's not your measurement that limits you. It's what you believe about it. The brain interprets perception as truth. If you think you're not enough, you'll carry that tension into every part of your life, from relationships to how you carry yourself. But when you understand that you are, in fact, within a healthy, normal range, something shifts. You feel lighter, more relaxed, more connected. And that's when performance and satisfaction naturally improve, not because of a change in size, but a change in mindset. Finally, how to support overall penile health. Let's go beyond measurement and talk about maintenance, how to keep the tissue, blood flow, and function healthy. Exercise regularly. Aerobic activity improves circulation. Better blood flow means better erectile function. Maintain a healthy weight. Excess fat can reduce testosterone levels and restrict blood vessels. Even a small reduction in weight can lead to noticeable improvements in performance. Avoid smoking and excessive alcohol. Both impair vascular health, which directly affects erectile tissue. Get enough sleep. Testosterone production peaks during deep sleep. Chronic sleep deprivation lowers hormone levels and energy. Manage stress. Chronic stress increases cortisol, which interferes with sexual hormones and blood flow. Mindfulness, breathing, or even a short walk can help more than you might think. Check your medications. Some drugs, especially for blood pressure or depression, can affect function. Never stop them abruptly, but talk to your doctor if you notice changes. These are small, practical habits that protect your vascular and hormonal balance, the real foundation of sexual health. So, the next time you find yourself comparing or doubting, remember this. You are not a number on a ruler. You are a whole person with a system that thrives on balance, health, and confidence. As a urologist, I can tell you, the men who feel most satisfied aren't necessarily the largest. They're the ones who understand their bodies, care for them, and approach intimacy with confidence and connection. That's what makes the biggest difference, always. Let's take a moment to pull everything together. You started this video with a question many men hesitate to ask out loud. What's the normal size? It's a question tied to curiosity, confidence, and sometimes quiet insecurity. But now you know the facts, not the myths. Science tells us the average erect length is just over 13 centimeters, or around 5 inches. Most men fall within a normal, healthy range that's much broader than what we imagine. And that means, statistically speaking, almost everyone is normal. You also learned how to measure correctly, from the pubic bone to the tip for length and midshaft for girth. No guesswork, no comparisons based on unrealistic images or unreliable sources, just clean, consistent data. Then we explored what really influences size: genetics, hormones, body composition, and even temperature. All natural, all variable, all part of being human. Nothing to fix, just to understand. And we talked about what truly matters most: function, health, and confidence. Your body is designed to work in balance. Good blood flow, stable hormones, healthy lifestyle. That's what supports performance and satisfaction, far more than centimeters ever could. Remember, anxiety and comparison are the real obstacles, not anatomy. When you replace judgment with knowledge, your body responds differently. You relax, you connect, you perform better, not because you've changed your size, but because you've changed your perspective. So, take care of your health as a whole. Exercise, sleep well, manage stress, and stay curious about your body. If something feels off, ask your doctor. Never be ashamed to talk about your health. It's part of being responsible and strong. Always remember, you're more than a number. Your worth, your masculinity, your ability to connect, none of that can be measured with a ruler. It's reflected in how you treat yourself and how you show up in your relationships. Trust your body, respect it, and give it the care it deserves. Because when you do, confidence follows naturally. And that's what's truly attractive, in every sense of the word. If you've made it this far, take a moment to appreciate yourself. You've chosen clarity over comparison. You now understand what normal really means and how your health and confidence are connected. Remember, the goal isn't to chase perfection, it's to know your body and care for it well. Knowledge is empowering. It replaces anxiety with awareness and doubt with confidence. If today's video helped you see this topic differently, I'd love for you to stay connected. Subscribe to this channel for more calm, doctor-led conversations about men's health, wellness, and confidence. Every week, we break down sensitive topics, the ones people rarely talk about, with science, honesty, and compassion, because every man deserves to understand his body without shame. And every question, no matter how personal, deserves a clear, professional answer. You're not alone in your curiosity. You're part of a conversation that matters. And by learning, you're already taking care of yourself in the best possible way. So, take care of your body, take care of your confidence, and take care of your health. I'm Dr. Rosalia Viterbo. Thank you for watching, and I'll see you in the next video.